Dear audience, I would like to present my PhD topic entitled Dental Prevention Procedures in Childhood and Children with Special Needs. First, let me introduce myself. I'm Dalma Tábi, and currently I'm working at the Department of Community Dentistry at the Semmelweis University. I envision as a PhD student that children with disabilities have a good oral hygiene, they can attend to a preventive educational program, and they have access to a high-quality treatment. My mission is to provide a healthcare program to these children with disabilities and to develop a method where the children's cooperation and oral literacy can be improved. Now I have two ongoing projects, and my first one is assessing the effectiveness of dental prevention programs among children. It's a systematic review and a meta-analysis. Let me say a few words about the project's background. As we all know, bad oral hygiene is a major public health issue, and it's affecting all age groups, especially children. So with severe oral health problems, we can decrease our quality of life. It can affect the children's sleeping, eating habits, and we have to do something against it. With this oral health education, we can improve their oral health knowledge. So the aim of this meta-analysis is to find the most effective methods. In this meta-analysis, we're investigating if there are school-based prevention programs effective in improving oral health in children. We compare studies where they used children who received this school-based oral health education, and they had a control group who not received this education by measuring their caries and periodontal indices. Our hypothesis is that children receiving this school-based oral health education will have a better oral hygiene, and as a result of this, they will need less invasive treatments, they can have a better patient service, and the treatment will be less expensive. Due to the heterogeneity of this topic, it was really challenging to compose a well-fitting search key. In general, we used 4 domains, 1 for the population, 2 for the synonyms and the setting of the intervention, and 1 for the required outcome. After several attempts, we conducted our systematic search on the 18th of November in these 3 databases. You can see on the chart that we had a quite broad search key for this topic to include all the necessary articles. And after removing almost 600 duplicates during the title abstract selection, we had finally 202 eligible studies. Now we are working on the full text selection, and it will be finished next week. My second project is a school-based prevention program for special needs children, and it's a randomized control trial in a pilot study phase. I have to mention this is an important topic to talk about because children with disability have worse oral hygiene in the world. So the presence, for example, their prevention programs are not uniformed, and in this way the follow-up results and the screening data are not complete. Another problem is the awareness and the knowledge of their parents or caregivers are incomplete. So although they have to be a key role participating in maintaining a good oral hygiene for the children. Our aim is to establish an oral prevention program for special needs children and assess their oral health improvement. Our clinical question if there is an improvement in the oral health of children with special needs after attending to a specialized prevention program. And our population are the children who attend to school at the András Pető Institute. They're receiving this specialized dental prevention program, and we compare them, the children who not yet received the education, and we measuring the improvement in their oral indices. Our hypothesis is that these prevention programs result in better oral hygiene in these children. We can improve their oral health literacy and their cooperation during the dental treatments, so that in the future there won't be a need for general anesthesia for them because of the cooperation problems. In the ethical approval, we set our inclusion criteria for the children who attending the András Pető Institute and who returned the informed consent form. It was a voluntary trial, it is, and we divided them into control and an intervention group randomly. Our intervention took place in the building of the school for 8 weeks with 8 children, and during the education we introduced the parts of the oral cavity, the proper toothbrushing methods. They could explore the dental office and try out the dental instruments under supervision, and we practiced a lot. During the dental screenings, we measured their periodontal and caries indices, and with the questionnaire, we like to assess their oral health-related quality of life, dietary and toothbrushing habits. We started this work in 2021 September with my thesis work. Then April we got the ethical approval, and after some preparation in October we started the pilot 1 group, because the first 2 groups we used as a pilot to complete or finalize our methods and to avoid the mistakes. Now we are planned to start our pilot 2 group in January and try to involve as many children as we can. Here a lovely photo of our group. And I would like to submit my meta-analysis in July, but for the prevention program we don't really have an exact finishing date. We got the ethical approval for 6 years. And I would like to finish a word from Teddy Artman from Grey's Anatomy. You have to go back to the beginning to understand the end. Thank you for your attention.
Dalma, congratulations on your progress. I have one question regarding your first topic. The intervention group seems a little bit heterogeneous to me. Are you planning to narrow the inclusion criteria, or are you going to make any subgroup analysis?
Yes, we are going to make several subgroups. For example, the categories from the school basis, for example, in kindergarten, high school, primary school, from the age, and we try to investigate the different type of education. For example, the PowerPoint, voice control apps, and we will make subgroups as well. Yeah.
First of all, thank you for the amazing presentation. And I have one question, which is how could you measure the cooperation of the children during the dental treatments?
Thank you for the question. Yes, I didn't mention, but we used the so-called Frankel scale. It's a scale from 1 to 4 to measure the cooperation of the children. 1 means that the children has no willing to take a part in the treatment, we can't treat them, and the 4 means that they were positive and they followed the orders.
Thank you for the presentation. Can you just go back to your framework slide for the first project?
Yeah.
So, yeah, you know, everybody knows education is very important. and with the implication that maybe less cost and better patient service. I mean, this study doesn't have any outcomes which are talking about these implications. This is just, we just suppose that in the end they're going to need less dental interventions and probably this is going to cost less. But I think this is a very good point for generalizing this type of programs for millions of children. So was the literature really that limited that you didn't have any kind of data regarding the cost-benefit results?
Yes, there were, I think, if I remember, about 2 meta-analyses with the cost and effectiveness of these programs.
Then why are they not outcomes for you? Why are you not interested in them as an outcome in your study?
Because there were no more articles, new articles to be included.
Right. And then speaking of the novelty for this type of program, I mean, we had some educational meta-analyses previous years as well. And your intervention group and your control group, it seems to me it's already biased because everybody knows education is very important and everybody knows education makes better results. So exactly in the end of this study, let's say that you proved with a fantastic p-value that yes, absolutely, education is very important. And then what? This is not telling us something that we don't already know. So what makes this study, what is going to be the contribution of this study into the, let's say, day-to-day practice? Because of course we know that education is very important. What new information is this study going to give us?
Thank you for the question. Yes, it's just a basic if these education programs are effective or not, because in the literature, I think there are differences. So some studies or meta-analyses said that they are not effective the way they did the education, but I think in the past 5 to 10 years, there are new studies with new methods to teach this kind of lecture, and in the future I would like to investigate which is the best way to teach these children. For example, with just a PowerPoint presentation, or we can use some kind of teledentistry or mobile apps for them to improve their oral literacy.
Okay, thank you. Thank you very much.